Today I am showing you the gross specimen of the fibroadenoma. It is a benign breast tumor and it is generally 2 to 4 centimeter in the size, and the age group it is seen in the reproductive women, but exceptionally it can be seen in any age group, and the size may be vary up to 20 or 15 centimeter. Normally it is solitary, but sometimes more than 2 fibroadenoma seen in a single breast. And gross feature, all these are the specimen of the fibroadenomas. You can see the size variability, and it is generally well circumscribed tumor. So it is a well circumscribed spherical, rounded to spherical masses are there, and it is unencapsulated. There is no true capsule is seen over it, and sometimes you can see the bossylated surface because of the projection. On the surface of it, there is a rounded protuberance you can see. Then we are using the word protuberance. After the cutting, the cut surface seen as a grey-white firm area, and you can see the slit-like spaces. These slit-like spaces is because of the compression of the duct by the stroma. Before moving on to the fibroadenoma, for UG student, you have to identify that you have received the slide of the breast tissue. So breast tissue is composed of the basically 2 tissues, the glandular part and the connective tissue part or the stromal part. So this is one lobule of the breast, this is other lobule of the breast, this is one other lobules of the breast, and in this lobule you can see the acini. All these are the acini. All these are the acini, and acini are nothing but they are blinded ends of the ducts, of the terminal ducts. And whatever the stroma inside the lobule, as I told you, this is single lobule, one lobule. So whatever the stroma inside the one lobule is called the intralobular stroma. So inside the lobule is called the intralobular stroma, and outside the lobule, whatever the stroma is there, this is called the interlobular stroma, or in between the 2 lobules, this part is interlobular stroma. So the 2 type of the stroma, it is very important because the fibroadenoma arises from the intralobular stroma, the expansion of the intralobular stroma. And in this diagram you can see very beautifully that this is extralobular duct, and it is going inside the lobule, and this part, this duct is called the terminal duct. So this is a very beautiful diagram of the TDLU, means terminal duct lobular unit, and the fibroadenoma arises, the site is TDLU. All these are the lobules, one lobule, this is other lobules, and under the low power also you can very well appreciate the intralobular stroma as well as interlobular stroma, because interlobular stroma it is a less cellular. Interlobular stroma is less cellular and it is dense, while intralobular stroma it is cellular and some myxomatous changes, bluish hue you can see, and it is a more cellular. Fibroadenoma is biphasic tumor. Biphasic tumor means there is a proliferation of the both glandular element as well as stromal element. So in this diagram, this is a typical picture of the fibroadenoma. In low power, you just can see how fibroadenoma look like. The important thing is you can see there is a proliferation of the epithelium as well as stroma, and this is intralobular. Intralobular means stroma which is present inside the lobule. The expansion of the intralobular stroma, and you can see appreciate the interlobular stroma. So interlobular stroma is dense, while intralobular stroma is loose and myxomatous, and there is a proliferation of all these duct and acini. All these are the acini. So few acini are rounded and few glands become slit-like. So this is typical picture of the fibroadenoma. This is high power view, and you can see this is bluish nature and the more cellular interlobular stroma, and this is interlobular stroma, and now the glands become slit-like here. The glands become slit-like.
So there are two type of the pattern because of the arrangement of the stroma, because of the glandular and the stromal arrangement, and because of the overgrowth of the stroma compress these glands in a slit-like spaces. So this is called intracanalucular pattern. When the glands become slit-like, just cord-like, then it is called intracanalucular pattern. Just there are two types of the pattern. The other one is pericanalucular pattern. When the glands become dilated, the glands is dilated and the stroma encircle these glands. So the stromal overgrowth is in such a way that it encircles the gland. So the open and dilated glands are there. This is called pericanalucular pattern. More high power, you have to see the bilayered epithelium, which is the most important finding key. It is benign tumor. So the epithelium bilayered. Outside there is a myoepithelial layer. So outside there is a myoepithelial layers, which is in horizontal, and the vertical is low columnar to cuboidal epithelium, and on the nucleus is round to oval. So this is two layers are preserved. So you have to see it under the high power.
I'm telling you a few more points so that you can better perform in your viva about the breast. So the breast tissue is composed of two parts, epithelial and the stromal part. And the epithelial tissue is like a branching tree-like structure. So this is branching tree-like structure, and we can compare the trunk with the lactiferous duct. So this is lactiferous duct, and this is acini. So this is last part is acini, and acini are nothing but they are blind ends of this duct. So this entire part is the epithelial component of the breast, and the other in between is stroma. So this is high power. Here you can see all the acini, they join together to form a lobule, and we can compare the lobule with the flower. So all the acini join together to form the lobule, and whatever the stroma around the lobule is called intralobular stroma. Means the stroma is around the lobules, or whatever the stroma is around the lobule is called the intralobular, and in between the two lobule is interlobular stroma. The other important finding of the breast is histological finding is TDLU. TDLU is a terminal duct lobular unit. Means the duct which is coming inside the lobule. So this is duct coming inside the lobule. So this is duct part. So this is terminal duct. So this is terminal duct. So this terminal duct and this lobule is forming a unit, and this is called terminal duct lobular unit. And this is a physiological active area of the breast, and many pathological diseases are arising from it. I told you two type of the stroma, intralobular and the interlobular stroma. The intralobular stroma is in this diagram you can see this interlobular stroma. All these are the lobules. These are the lobules. So all these are the lobule, and the stroma present here, this blue star is intralobular stroma. This intralobular stroma is loose and is more cellular, while interlobular stroma is dense. Though it is a dense, but it is a less cellular. There is a less cellularity, we can appreciate very well. It is less cellular, and hormonal responsiveness is seen in the intralobular stroma. So this intralobular stroma is showing the hormone responsiveness. And this is TDLU. You can see this is extralobular duct, and this duct is going inside the lobule. So this is terminal duct, or we can say the lobular duct, and all these are the acini. All these are the acini, and this is intralobular stroma. So this is TDLU. And in the high power, you can appreciate the two type of the epithelium. This is myoepithelial layer, horizontally placed, and the vertically placed nuclei are the epithelium. And here you can appreciate the cytoplasmic there's a snouting we can appreciate. Fibroadenoma is the most common benign tumor of the female breast, and it is a biphasic tumor. Biphasic means it arises from both epithelial and the stroma. There is a proliferation of the both kind of the tissue, epithelial and the stroma, and it is generally seen between the reproductive age group 15 to 30, but exceptionally it can be seen in any age group. And it can regress after the menopause or as the age is going to advances. And during pregnancy, the size is increased. Origin is from the TDLU. So fibroadenoma arises from the terminal duct lobular unit, and the stroma, whatever the stroma is going to expand, is intralobular stroma. The clinically, normally it is a single, but multiple can be seen, and as it is a freely mobile in the breast tissue, so it is a mouse. We can say it is a mouse of the breast. And gross feature, this is 2 to 4 centimeter size generally, but it can vary from 15 to 20 centimeter also. It is a spherical discoid to ovoid mass, and it can be easily shelled out surgically. And it is a well circumscribed, but it is unencapsulated. Most of the book showing that it is a capsulated, but it is unencapsulated tumor. There is a pseudo capsule is formed by the surrounding breast tissue, and the surface is smooth. Sometimes the rounded protuberance or the projection may be seen over it, and the shape is distorted. Then we are using the word vacillated surface. Now, cut surface, after the cutting, we can see the firm gray white area. Sometimes we can see the slit-like spaces. They are formed because of the compressed duct. And whorl pattern can be seen when there is some degeneration, like mucoid degeneration we can appreciate. Sometimes it is more fibrotic, and even calcification we can see in the cut surface. Microscopic, because it is a biphasic tumor, there is expansion of the both stromal and the epithelial components. So what kind of the arrangement they are taking? So the arrangement between the stromal overgrowth and the duct may produce two type of the patterns of the fibroadenoma, the intracanalicular and the pericanalicular. So intracanalicular pattern, in which the stroma compress the duct and the gland or duct become reduced to a slit-like or cleft-like, and they appear as a cord-like element. And in the pericanalicular pattern, it is characterized by the encircling masses of the stroma around the patent or dilating duct. So in the low power, we can appreciate it as a rounded duct. And here the oval or round configuration of the gland is preserved. Both the patterns are seen in the same region, and the distinction has no any clinical significance. Fibroadenoma vary in the appearance from case to case. Means in the one fibroadenoma appear differently, the other fibroadenoma depend because of the what kind of the stroma is going to proliferate. The gland are composed of the cuboidal to low columnar with the round regular nuclei resting on the myoepithelium. So two type of the epithelium we have to see. Now this is intracanalicular pattern, because stroma is compressing the duct in a cord-like. So here the gland becomes slit-like or cord-like. Here this is high power view. You can see the stroma is compressing the duct in such a way that it becomes slit-like. So this is look like a eye shape. So you can remember it by the word eye. So eye means intracanalicular pattern. Now other one is pericanalicular pattern, and this the gland assume or remain as a round in the shape, because stromal overgrowth is in such a way that it encircle the gland. So in the low power, it look like the rounded glands or rounded ducts. So this is pericanalicular pattern, and this is pseudo capsule, and it is formed by the surrounding breast tissue. And here you can appreciate bluish hue. So it is a myxomatous changes. Here there is a calcification. So these are the certain changes may be there in the fibroadenoma. So sometimes we are using the word complex fibroadenoma, and when we should use the word complex, when there is a cyst in the breast more than 3 millimeter. Fibroadenoma that contain a cyst more than 3 millimeter, or sclerosing adenosis, epithelial calcification, or papillary apocrine changes, then we are using the word complex fibroadenoma, because relative risk to be converting into the malignancy is more compared to the normal fibroadenoma. We are using the word juvenile fibroadenoma. It is using in the young. It is seen in the young girls or in adolescent girl. And here these three things we have to focus. There is a stromal cellularity, more and more stromal cellularity, and epithelial hyperplasia. Means Normally, I told you two type of the epithelium, inside the epithelial and outside myoepithelial layer. And here there is a proliferation of the epithelial cells. So there's a more than 2, 3, 4 layers may be seen. So there is epithelial hyperplasia, stroma cellularity, and they assume as a pericanalular pattern. So this is seen in juvenile fibroadenoma. The other morphological variation, so the examiner may ask, what are the morphological variation of fibroadenoma? Then there may be hyalinization, calcification, ossification. Sometimes the giant cells may be seen in the fibroadenomas. Some um, some other tissues like mature adipose tissue, smooth muscle, and the metaplastic cartilage may be seen, and myxoid changes may be seen. We can use our cellular fibroadenoma depending on the cellularity of the stroma. Sometimes function changes of the infarction may be seen. I covered the complex fibroadenoma. Sometimes the epithelium may be metaplastic. Lactational changes may be there. So this was all about the fibroadenoma. Thank you very much for careful listening.